say that there is thunderstorm happening here. There might be some sound disturbance at the back. So please excuse me if you hear some thunder in between. So my topic is donning and doffing of PPE. The items needed for ophthalmic practice was enlisted by Dr. Gagan, but it is not a big list. What we need depends on the level of protection. The level of protection is not the same everywhere. There are several factors which are involved in the level of protection. The area where you are practicing, if the infection rate is very high, it is a hot zone, then the level of protection has to increase. The level of practice you have, the number of patients you're going to see, what type of preventive measures you have taken, it's equally important to measure the level of protection. Air conditioning is yet another important thing where there is aerosol formation and the level of protection has to increase. If you're not using air condition, you don't need to increase the level of protection. What is normally needed in ophthalmic OPD is the gowns, mask, respirator, face shield, goggles, and the gloves. These are the basic things we need in ophthalmic practice. One thing you should understand this virus enters through the mouth, nose, and to a very little extent the eyes. So the nose and the mouth are the most important part to be protected in PPE. The gown we wear from the neck to the knee to the wrist protects our body, the dress we wear. But the actual protection is what we need is the mask and the respirator. What can be used in ophthalmic practice is the surgical mask and the respirator N95. What does this 3-ply mask mean? It has got 3 layers. The outer layer, which is made up of polypropylene, spun-bound, non-woven material. The middle layer is the filter, and inner layer is again the polypropylene, spun-bound, non-woven material. The N95 respirator is again the same, but it's got 2 filters in addition to the spun-bound outer and inner layer. There is one electrostatic melt-bound layer and as well as an N95 filter material in it. It filters about 95% of the virus. The face shield and the goggles are there. But this face shield is quite difficult for us to do the slit lamp examination, to do surgery. So what is better than that is a goggle. A goggle, there are certain models which will accommodate our glasses, spectacles inside the goggle and give a very good view, and you can go close to the slit lamp and examine. And coming to the gloves, we have different types of gloves, the nitrile gloves, the latex gloves. But the nitrile gloves are made up of copolymer and less allergic and provides protection against the chlorinated solvents, because we are going to use a lot of chlorinated solution during this time. And what CDC says is prolonged and indiscriminate use of gloves should be avoided as they may cause adverse reaction and skin sensitivity. So what is needed essentially only procedure, you wear gloves. So if you go to the sequence of donning of PPE, the first and foremost is hand hygiene. And when you enter the OPD, it is better that for the first time use water and soap to do hand hygiene. Then wear your gown, mask, goggles, and the glove last. This is the sequence what has been advocated. So the general consideration is keep hands away from the face. Limit surfaces touched. Change when the PPE is torn or heavily contaminated. Work from clean to dirty area. This is the basic principle. So the first step in donning is hand hygiene. That is water and soap for the first time. And first step in donning is hand hygiene. You should follow all the steps described by the European norm. Never compromise on that. Then donning of the gown. Then coming to the mask. The mask has got an outer surface, outer side and an inner side. In addition to that, there is a bar on top which is meant for the nose. So the outer side is darker and the inner side is lighter. And that's the lighter side goes to the wearer's skin. So when donning the surgical mask, the upper tie is tied first and the lower tie is tied next. Then the waterfall pleats are pulled down and expanded in the way, and the nose pad is adjusted, and check for any leakage by blowing gently. That's the way to check for your surgical mask. The respirator, again the same step, hand hygiene, and hold it like a cup without touching the inner part of it. Place it on the face, put the upper string first and then the lower string, then adjust the nose pad and readjust so that there is no leak. This is the donning of N95. And finally, you are ready for the OPD procedures. General consideration is do not touch the outside of the mask. Do not adjust the mask once worn. If so, wash hands. If soil or wet or integrity is broken, change mask. 4 to 6 hours is the maximum time a mask can be worn. Doffing of PPE. First the glove comes out, then the goggles, then the gown, the mask, and then hand hygiene. The mask has to come out last. That's very, very important. Everywhere in PPE, the mask has to come out last. So how do you remove the glove? You pinch the glove from the outside without touching the skin. Remove one glove, then go underneath the glove and remove the second glove, followed by the goggles and the shield, then the gown. Doffing of N95 respirator, the lower string is brought forward, then the upper string, and it either discarded or stored in paper as for the next use, as you number it in Ames method. Then following which you should do your hand hygiene again. Now I'm going to come to something very, very important. I say it as a caution. Let's look at a face and what happens when we wear a mask and a goggle and expose ourselves to the contamination. The entire area is getting contaminated. And when we remove the mask, these are the areas which are not covered by the contaminants. So these areas is only protected. So once you remove the mask and rub your face, you're going to lose everything. So putting a mask like this is going to do more harm than good. So putting it down and then pulling it back is going to do more harm than good. So best thing is to, after the consultation, have a shower, change over to your outside street clothes and then go. Now, personal protection equipment, as far as OT is concerned, the gown has to be more protective. Respirator N95 is a must. Face shield, goggles is a must. Gloves, preferably double glove and shoe cover is added. So in a stage when the protection is enhanced, we'll have to go in for the protective cover all. So now going to the steps in the donning, the first step is to change to surgical dress. Then wear the shoe cover. Do hand hygiene. Then put the N95 mask. Put the cap. Then put the 3-ply mask. Then the goggles. Then do the scrub. Wear the gown. And put one glove, the second glove on top of it, and you're ready for the surgery. These are the steps to be followed for surgical procedure with minimum protection. Doffing, the first thing comes out is your gown along with the gloves. Then wear a protective glove. Remove your shoe cover. Then remove the glove. Do hand hygiene. Put another pair of glove. Remove the cap. Then the surgical mask. Then the goggles, do hand hygiene, and last you remove the N95 mask. Have a shower, change over to another new set of scrub, and wear a fresh surgical mask. Thank you so much.